So hi everyone, my name is Sage and this is my presentation on my experience completing my practicum at the Vancouver Island Drug Checking Project. I'd like to start by acknowledging that I did my work on the traditional lands of the Lekwungen people. As an uninvited settler, I'm grateful to be able to live and work on their land. I completed my practicum at the Vancouver Island Drug Checking Project, a research project within the Canadian Institute for Substance Use Research at the University of Victoria. The project was initiated by Bruce Wallace, my supervisor, and Dennis Hoare to implement innovations in drug checking technologies within community settings. Their main site, called Substance, is in Victoria, where they offer free and confidential drug checking services using multiple instruments to determine a sample's main active ingredients, fillers or cutting agents, and any unexpected drugs, as well as the presence of fentanyl. Additionally, they have distributed sites around the island and offer a mail-in service for people that live far away. In addition to their service, the project releases weekly, monthly, and yearly reports. I included a sample of a weekly report that we would put out. They also release reports on trends or any topics of interest, as well as publishing studies on their findings related to drug checking services and technologies. I think it's important to note that this project is a direct response to the overdose crisis in British Columbia. BC currently has an unregulated and volatile drug supply that has taken thousands of lives. In 2016, the overdose crisis was declared a public health emergency, yet overdose rates have significantly increased since then. Having access to informed consumption and harm reduction services is an important step in reducing these numbers. The project's mission was to explore opportunities and benefits of different drug checking instruments, technologies, and services. They also seek to learn how drug checking can support those impacted by and responding to the overdose crisis, with attention to principles of social justice and the impacts of current drug policies. Furthermore, they hope to reduce the stigma and criminalization of those who use drugs, as well as to improve health outcomes. During my time at Substance, I took on a variety of tasks and responsibilities. I spent a large portion of my time working in the frontline harm reduction role, which required me to intake samples, fill out a survey, strip test the sample, and provide user with comprehensive results after further testing. I was also there to just chat with folks and provide harm reduction supplies and information. I also made some resources for service users, including compiling a list of meal services in the area, as well as making a pamphlet for services supporting vulnerable youth in Victoria. I also participated in biweekly meetings with project staff. Another role I had was doing weekly outreach, where I would go around Victoria to 7 safe consumption sites in collaboration with a member of Solid Outreach Society. During outreach, we would collect samples, connect with people in the community, and provide them with weekly reports. Additionally, I reached out to other related organizations to provide information on the project as well as resources for them. The knowledge and skills that I gained from this program guided my work within my practicum. Particularly, the PHSP skill that I integrated was examining the role of community engagement and community leadership in promoting health and social justice. During the program, I was taught the importance of empowering a community to take initiative over community building using a strength-based approach that uses the strengths and abilities of community members. I use this skill by viewing people who use drugs as their own experts and working towards empowering them instead of telling them how to improve. Throughout my time, I had many conversations with service users and was constantly asking them how I could improve the service to best work for them. I didn't come into this believing I knew what was best. I came in with curiosity and the intention of learning from the community. The PHSP value that further guided my work was taking a critical analysis drawing on social justice and equity principles. With the nature of this work, I was working with a community that has been underserved and severely discriminated against. Thus, I use social justice principles to actively work towards providing equitable services and removing barriers for improving health. Some examples include doing my outreach, which removed the barrier that people have of actually getting to service, as well as providing harm reduction supplies, which removes the barrier of cost. My experience with this practicum has been really meaningful and personal to me. I've lost people in my life to overdose and continue to have people I love struggle with addiction. So through life experience, I understand the damaging impact that stigma and judgment have on people's lives and well-being. The work this project does to uphold people who use drugs as deserving of care, dignity, and access to informed consumption was really inspiring, and I'm really grateful to have been given the opportunity to be a part of it. The staff at Substance have created a non-judgmental environment with a neutral view of drugs that prioritizes service users' health and well-being rather than simply focusing on sobriety. This was really significant to me because regardless of whether someone uses drugs or not, they deserve safety and care. Another valuable aspect of this experience was developing relationships and gaining insight and knowledge from the staff at Substance and Solid, along with people in the community. I learned how I can better my work within community work that I will bring with me as I move forward into my career. Something I'm most proud of was coming into this work with no previous frontline experience and overcoming the challenges that come along with this kind of work. I was put into challenging and emotional situations that was all very new to me. However, I worked really hard to listen and learn from the people around me to serve this community the best I could. The piece of feedback I received at the end of my practicum that I appreciated the most was that people appreciated my gentle and empathetic approach to community work. What surprised me most about this experience was learning how much widespread misinformation there is on drugs and drug use that further perpetuates the negative stereotypes that people who use drugs face. I was also surprised to learn how little resources there are for people who use drugs. While there are many amazing organizations that work really hard, there is still this gap that people in the community face in terms of support. The call to action that resonated with me the most was we call upon the federal, provincial, territorial, and Aboriginal government to acknowledge the current state of Aboriginal health as a direct result of the previous Canadian government policies, including residential schools, and to recognize and implement the healthcare rights of Aboriginal people as identified in international law, constitutional law, and under the treaties. I think this is incredibly relevant to the work I did, as colonialism and particularly residential schools has created a lot of intergenerational trauma that has led to high rates of addiction and overdose in Indigenous communities. After graduation, I will operationalize this call to action through positioning myself as a lifelong learner. I will seek information to develop a more complex understanding of colonialism's impact on Indigenous health, as well as actively promote and support the implementation of Indigenous-focused and culturally safe care. Okay, I just want to say thank you for listening to my presentation. I would like to first thank Bruce for being my supervisor and giving me this wonderful opportunity. I also want to thank Kayla for supporting me through every step of the way through Upper Practicum, as well as Jimmy for doing outreach with me. And also just thank you to everyone that worked at Substance. Everyone was so welcoming and lovely, and I learned so much from everyone there. I also want to say thank you to Heather and Natalie for guiding me through this experience and providing me with the skills and knowledge to succeed in my practicum. And then also just congratulations to all my fellow students. It was wonderful learning alongside you, and I look forward to seeing what you all do after graduation. Thank you.